extinguish our light. This is not one of those moments at all. This is a moment for pretty much the opposite. For hiding, for laying low. Napping is also good. Saving humankind by really, really not getting near it. Where playing games, staring at screens, staring at anything, all are the stuff of heroes. Every generation has its moment, where individual sacrifice makes way for the good of those who will come after. A higher purpose. This one is ours.
When you feel a sneeze or a cough coming, covering your mouth prevents the spread of germs. You probably knew that. But the way you cover up also matters, and that means breaking a habit you've held near and dear all your life. Cover your nose and mouth with your flexed elbow or a tissue, not your hands. Discard the used tissue immediately. Then wash your hands. Help stop the spread of germs. Remember, your health is your responsibility.
A message by the Health Promotion Unit of the Ministry of Health, Wellness and New Health Investment, Dominica.
Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. COVID-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
I did not imagine that the prayers of my country would have been answered so swiftly.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18. Take the vaccine to protect your family. Take the vaccine to safeguard the elderly. Take the vaccine to bring back with festivals. Take the vaccine. Take the vaccine. Take it. Take the vaccine. Need it. Take the vaccine. Take it. Take the vaccine. Need it.
This is a message from Tasha P. and the Health Promotion Unit of the Ministry of Health, Dominica.
Hey, Bernard, I see people sanitizing their hands before they enter your bus. Tell the people of Dominica, why have you enforced this?
My bus is my livelihood, and that's why I make sure all my passengers wear the mask and sanitize their hands to stop the spread of COVID-19. We all are in this together.
You have heard it here first. Let's all join the fight against COVID-19 in Dominica.
The coronavirus disease may spread when people touch contaminated surfaces and then touch their face. Regular cleaning and disinfecting of surfaces that are frequent touch points helps to prevent disease spread. Every home is different, but common high-touch surfaces include door handles, tables and chairs, handrails, kitchen and bathroom surfaces, taps, light switches, phones, computers, and remote controls. Nurse and health educator Sabrina Bernard will share guidelines with you on general cleaning of all types of surfaces, including in the home and in the office, and the type of disinfectant that should be used.
Approved cleaning solutions used to clean surfaces: Lysol liquid, Lysol wipes, alcohol 70% and above, alcohol wipes 70% and above, 10 ounces of bleach in 1 gallon of water, or quarter cup bleach in 1 gallon of water. Surfaces that should be sanitized in the offices are office desks, chairs, keyboards, mouse, phones, printers, scanners, cubicles, doorknobs, and the light switch. For the home, tabletops and countertops, chairs, doorknobs, light switch, toilets, bathrooms, cupboard knobs and holders, and stair rails. How long do COVID-19 last on surfaces? On aluminum, 2 to 8 hours. On surgical gloves, 8 hours. On steel, 48 hours. On wood, 4 days. On glass, 4 days. On paper, 4 to 5 days. And on plastic, 5 days.
Good evening, ladies and gentlemen, and thank you for joining us for this COVID-19 briefing. Of course, we're here not just to provide you with statistics, but with valuable information as we continue in our fight against this dreadful pandemic. With us this evening, we have Mrs. Katharina Jemmett, who is the lab superintendent. We also have Dr. Laura Esprit, the director of primary healthcare services, and Dr. David Johnson, chief medical officer. We'll be touching on 3 areas this evening: testing, public behavior, and of course, protocols. Spearheading our testing efforts are our diligent testing teams and of course, the lab at the Dominica China Friendship Hospital. And that's why we have with us, and we'll welcome her first off, Mrs. Katharina Jemmett, lab superintendent.
Thank you, Sheena. A pleasant good evening to the listening public and my colleagues. This evening I'll provide an update on the continued role of the laboratory in this COVID-19 pandemic. As we would be well aware by now, testing is part of the first line of defense against COVID-19. It enables early identification and isolation of cases in order to slow transmission, provision of targeted care to those affected, and protection of health systems operations. Laboratory tests for COVID-19 based on PCR were rapidly developed in the early days and weeks of the pandemic. Such tests typically require sophisticated laboratory infrastructure and skilled staff. To date, hundreds of millions of COVID-19 tests have been performed globally, but the demand for timely, accurate testing continues to outstrip supply. Since the start of the pandemic, the Ministry of Health has employed the use of the PCR, antibody, and antigen tests for diagnosis of suspected cases, routine surveillance, and contact tracing. While the PCR test remains the gold standard for COVID-19 testing, it is labor-intensive and takes several hours or days for return of results. In an outbreak situation, what is required is a reliable test which can provide results in the shortest possible time in order to identify cases and curb the source of transmission. The antigen test validated at the national laboratory satisfies this criteria. The test kits have been cleared by the FDA and have been validated in our Dominican population. Observing WHO guidelines on the use of the antigen test in outbreak situations, our current prevalence of COVID-19 in Dominica, the observed correlation of 98% between our PCR test and the antigen test results allows for the use of the antigen test to confirm a case of COVID-19. While we employ the use of the antigen test for contact tracing, any symptomatic individual testing negative by antigen test is given a PCR test. Therefore, the antigen test is used to complement the PCR testing. So what is the rationale for testing? We test to protect our borders against the importation of cases, to manage persons in quarantine and isolation units to ensure that they are medically clear, to satisfy pre-travel requirements for community surveillance and the clinical management of cases. So with the surge in cases in our local population recently, this has no doubt resulted in a significant increase in the workload as it pertains to PCR testing. On average, the workload has increased fourfold. This increase in workload requires us to pay even closer attention to our processes in order to maintain quality. With PCR testing, the processes are many: data entry, sample preparation and testing, result validation and reporting, all of which contribute to the comprehensive quality output. We continue to recognize the development of the molecular department within the National Laboratory as a major accomplishment. The dedication of the team cannot be overemphasized. These young persons continue to do us proud at this most critical time in our nation's history. 6 individuals are dedicated to conducting molecular testing. 3 have joined the team in the past 2 months. These dedicated workers are complemented by a support team of administrative and technical personnel. Increasing the cadre of dedicated molecular staff has allowed for an additional evening shift and increasing our output from 100 to 200 tests per day. This has enabled the laboratory to respond to the ever-increasing demand for PCR testing for travelers, persons in quarantine, contact tracing, and routine surveillance. The laboratory staff has not only been involved in PCR testing, but is currently spearheading the training of healthcare providers in COVID-19 antigen rapid testing all over the island. To date, over 100 healthcare providers from all over the island have been trained in the use of this rapid antigen test. So what are our plans to increase capacity? In addition to the above-mentioned accomplishments, ongoing measures to increase capacity include commissioning of a molecular testing facility in Portsmouth, purchase of an automated extraction system, which will allow for the processing of an average of 400 PCR tests per day, training of additional personnel in molecular testing in the coming week by PAHO. In terms of our reagents and supplies, it's needless to say that the ability to perform thousands of PCR COVID tests requires a large quantity of reagents and supplies. These items are not just expensive, but they are difficult to procure in this ever-increasing demand for the items on the world market. The Ministry of Health, and by extension the government of Dominica, continues to procure significant quantities of reagents and supplies to support testing. Currently, sufficient stocks are available to manage the increased demand occasioned by this surge. Additionally, a shipment of 4,000 PCR tests is expected in the coming week, 10,000 from the Chinese government and 30,000 from PAHO. We remain grateful to our donors and fellow governments and continue to provide the support that we need in fighting this pandemic. I thank you.
Thank you so much, Mrs. Katharina Jemad, who is the lab superintendent. And of course, we commend you and your staff for your dedicated service during this pandemic. Next this evening, we welcome the Director of Primary Healthcare Services, Dr. Laura Esprit.
To our lab superintendent, Mrs. Jamot, to the Chief Medical Officer, Dr. Johnson, to our Minister for Health, Permanent Secretary, Moderator, and to you, the listening and viewing public, good evening. As healthcare providers, we did all the hard work for you. We sat and wrote protocols for days, weeks, and months. We did the trainings on local, regional, and international platforms. We learned how to swab with antigen and antibody test kits, as well as how to conduct PCR tests using sophisticated equipment. We learned the proper use of personal protective equipment. We learned the mechanism of action of vaccines and educated you accordingly. Don't forget, we also cared for all your health needs amidst a raging pandemic that has claimed the lives of over 4.3 million people worldwide. We did all of that and more. So that meant you had only one primary task: strict adherence of the public health and social protocols. Now, what does strict adherence mean? It is the action of continuing to obey a rule, a law, an agreement, etc. Yes, continuing, as in present continuous. So has every single one of us been continuously observing the rule as it relates to the public health and social protocols? Heartbreakingly, the answer is no, we have not. Now, what are the consequences of this disobedience or non-adherence to the rules? When applied to the context of infectious diseases, the consequences mean quicker transmission and spread of the virus, exposure of our vulnerable groups, deaths, and the resulting overwhelm the healthcare system, among others. And in these cases, everyone suffers. In other words, if a few irresponsible persons decide to fet like there is no tomorrow, ignoring the established protocols, then all Dominicans will face the dreadful consequences. Farmers, when last have you planted potatoes and harvested yams? Have we ever planted cucumber seeds and reaped tomatoes? That would be the day. In other words, what we reap is what we sow. Even the book of Proverbs provides insight as to how we should deal with the pandemic. And if you look at chapter 22 and verse 3, it states that the shrewd one sees the danger and conceals himself, but the inexperienced keeps right on going and suffer the consequences. The shrewdness, or the ability to show good powers of judgment, was evident in the first wave in Dominica. And I am sure you can attest to the fact that when this started, we were super vigilant. Remember leaving your shoes on the doorsteps? Remember coming to work with extra clothes to change before returning home? And we did exceptionally well at keeping cases to a minimum, even proudly boasting that Dominica had no COVID. On the flip side, it is evident that once protocols are neglected, then we will all suffer the consequences. Now, what are the facts? Let's list them, at least some of them. Fact number 1, the outbreak began on July 28, 2021, first detected in the Portsmouth Health District, and has continued over a 16-day period. Fact number 2, of the 339 positive cases, 52% or 176 persons are males, while 48% or 163 persons are females. The youngest diagnosed with COVID, based on the most recent data, is a 2-month-old, and the oldest, 88 years old. Again, these are the facts. Fact number 3, in the first half of the outbreak, that is within the first 8 days, we recorded only 7% of our antigen positives and 9% of PCR positives from our total 339 cases. Unfortunately, in the last 8 days, we have recorded 93% of total antigen positives and 91% of PCR positives. These statistics therefore speak to the fact that cases continue to rise. Fact number 4, many persons were engaged in the non-observance of the established protocols, including that of mass gatherings, which catapulted the outbreak. Fact number 5, in this wave, the virus appears to be very infectious, with many cases affecting our most vulnerable population, including children, the elderly, the disabled, and the housebound. Fact number 6, many are also symptomatic, presenting with fever, headache, vomiting, diarrhea, new loss of taste, new loss of smell, cough, fatigue, shortness of breath, and joint pain, which were not as prevalent during the first wave. Fact number 7, positive cases appear to be in almost every village island-wide, but most predominantly in the Roseau Health District at this time. Bear in mind that the district stems from Warner and Campbell in the north to Soufriere and Scott's Head in the south. This is not to say that the other health districts are not concerning. However, the Roseau Health District has been identified as the current epicenter. We have recognized that the following communities are the areas of most concern within the Roseau Health District: Stock Farm, Tarishpit, Soufriere, Point Michel, Scott's Head, Bath Estate, Silver Lake, the Roseau Valley, Maho, Campbell, Bellevue-Chopin, Kingsville, Kingshill, and Foncolé. Fact number 8, this virus has proven to have no respect for age, gender, status, religion, creed, workplace, or political affiliation. Some of our essential workers, unfortunately, have been diagnosed with COVID, including our fire officers, healthcare workers, police officers who have had no recent travel history. These are the people who can't remain in the safety of their homes, but rather go out every day to provide us with the services that we need, and yet we have put them at risk. Fact number 9, even some of our vagrants have been exposed to COVID-19. Fact number 10, Many businesses across Dominica have had to scale back due to the loss of manpower as a result of staffers needing to quarantine or to isolate. Fact number 11. At this time, there are persons pending transfer to the quarantine unit as well as the COVID unit. Please bear with us whilst we make the necessary arrangements for your accommodation. And last but not least, over the last 16 days, there have been more than 326 interventions from calls made to the COVID hotline. Now, what are some measures that have been put in place to mitigate this situation? Various testing sites have been established around the country for ease of testing, including mobilization of 3 testing teams. Systems have been put in place specific to the north of the island to care for the medical needs of persons quarantined at the various facilities, as well as those admitted to the COVID isolation unit. Various resources have been reallocated to ensure that supplies and other needs are readily available to respond to the level of this crisis. All essential workers were recalled, ensuring that the human resource response is at its maximum. And various protocols have been amended to ensure that the ministry remains abreast with the management of the increasing number of cases as the situation remains fluid. Now, what are some areas of concern and observation? Some primary contacts are not forthcoming in identifying themselves and getting tested. That's a major concern. Some persons are of the view that a negative test is an excuse to behave recklessly, and the danger is experienced when the client repeats the test days later to a positive result. By then, many other persons would have been exposed to the virus. We are concerned, too, that many fail to comply with the directives given following testing. Some persons continue to ignore the safety guidelines, such as the use of face masks and physical distancing. They're living in the now with total disregard for their health and that of others. Some persons continue to withhold information or provide inaccurate information for contact tracing. For example, we're being given wrong names, wrong telephone numbers, wrong addresses. Persons deny being at certain events, inclusive of church, parties, or CWO, as we call it. However, when traced on social media, their attendance is confirmed. Other concerns? We continue to receive misleading information as to the existence of symptoms or their severity, which would require diversion of resources from a genuine symptomatic client who ought to have been given priority. Observations continue. There are those who propagate fake news of emergencies by engaging the hotline services, and this really consumes precious time for investigation and response. After being tested positive, persons would actually use social media to discourage others from being tested. Some tend to manipulate the statistics of the dashboard to create widespread, unnecessary panic. And last but not least, parents believing that their teens are old enough to go out to parties, yet are too young to proceed to quarantine alone. Bear in mind that there are more concerns, but time will not permit me to list them all. Now I wish to help you to do some introspection with these questions. How can you value life such a precious gift, witness the upsurge in cases on a small landmass like ours, and yet host a birthday party in the dark, thinking you deceived the curfew order, while exposing your children to the virus. That's very disturbing to me. How can you hear or see the frequency by which the ambulances go by and not reflect on your own behavior? How can we have you quarantined for your own health and safety with a diagnosis of COVID, and the government quarantine facility becomes a place of disorder and an extension to the dance hall and the hair salon? What will it take to abandon the spirit of selfishness, which is what it is? Selfishness. Must it take a death in Dominica for this pandemic to be seen as serious to you? Or must it get to your doorsteps first for the reality to kick in that COVID is real and is among us? Listeners, if I have found a way to have you rethink your actions for the better, then my objective at this briefing would have been met. Recommendations going forward are therefore enlisted in 4 main areas. The first one, self-care, inclusive of your mental health. What do I recommend? Boost your immune system with a daily supply of vitamin C, multivitamins, or other supplements. Eat a balanced, nutritious meal and stay hydrated. Indulge in regular local bush teas. Example, ginger tea, lemongrass, cinnamon, turmeric, and you may know it better than I do. Recommence the backyard gardening and baking of new recipes which once brought you a sense of satisfaction. Get enough sleep and rest. Confide in a trusted friend or your therapist, getting the world off your shoulders. Give the digital world a break and bond with your family, and better yet, learn some Bible truths. Also, feed your brain with positivity. For those with chronic conditions, example, diabetes, cancers, hypertension, etc., continue to take your prescribed medication with regularity. And to the unvaccinated, you do have opportunities to be vaccinated amidst this surge, with options available to you at the larger health centers across the island, as well as the Windsor Park Sports Stadium. And lastly here, there is no need to be overly anxious, as stress weakens your immune system and makes you more vulnerable. Let's move to recommendation number 2. Observe the protocols. Praying for God's protection while intentionally not protecting yourself doesn't help. It doesn't cut it. As the good book says, God helps those who help themselves. Observe all the health and social measures in its entirety as they all work together. Have daily temperature logs for you and your family, and monitor for any onset of illness. Practice regular cleaning and sanitization of your homes and workspaces. Do not roam unnecessarily unless there is a genuine reason to leave your home. Now is not the time to make multiple trips to the shops to get flour, then again for sugar, and then a malt, maybe a shandy later, and some matches. Or to make trips to Roseau every day of the week to merely get a sense of what is happening. This is no time for visitors at home, especially if there is a vulnerable person living there. So let's stop it. And yes, it is summer, but our children should not be allowed to mingle with their peers, obviously for their own safety. Number 3, know your status and take responsibility for your own health. Daily antigen testing is available across the island at the following areas: the Windsor Park Sports Stadium, the Grand Bay Health Center, St. Joseph Health Center, the Reginald Fitzroy Ammer Hospital in Portsmouth, the Cassie Bruce Health Center, and the La Plaine Health Center. Additionally, 3 mobile teams are deployed to various catchment areas of the health districts. On that note, test smartly. While we encourage all to know their status, if you have been identified as a primary contact of a positive client, say 12 hours ago, it is impossible to know your status by antigen testing today. As such, testing is recommended on day 5 post-contact. For example, being exposed on Sunday, day 5 would be Friday, with the day of contact as day 0. Who should test? All of us. Tout mundo. Todos nosotros. And how is it done? By simply using a swab that is inserted into the nose, and after processing on site, results are provided shortly thereafter. And the last area for recommendation, number 4, maintain your negative status of COVID by all means necessary and avoid a complacent and disobedient spirit. And this last one really speaks for itself. On this note, I wish to express my special thanks to the following persons. To my colleagues who have been working tirelessly, night and day, from day 0 to contain this spread. To my colleagues who are concerned of the current situation of this upsurge amidst the reckless behavior, but the health of our citizens give them the motivation to keep at it. To our families, spouses, children who hardly see us, we say thanks for your love and understanding. To those who have been recalled from vacation and literally awaited the call to hit the ground running, as well as those who simply presented themselves for the call of duty. To those who have had losses in one way or another, yet have responded willingly to the needs of the country. To the various teams of contact tracing, testing, lab, pharmacists, port health, hospital, supplies, COVID unit, quarantine, transport, volunteer groups and organizations, the private sector, and of course to those I forgot to name. To our colleagues, both in health and other essential services, who have befallen this terrible illness, we will hold the battle lines in your absence until you have recovered successfully. You must recover successfully. To Dominicans who believe the lives of frontline workers matter and show it in action by adhering to the protocols and appreciate the fact that our work is not in vain. And to the ones who were once reckless and are now motivated to assist us in this battle against this dreaded disease, from my heart to yours, thank you.
Our thanks to Dr. Laura Esprit for reminding us that defeating this virus will take a change in mindset and a change in lifestyle by all of us. And finally, we welcome this evening the Chief Medical Officer, Dr. David Johnson.
Thank you very much, Ms. Harry, and good evening to you, the listening and viewing audience. We in Dominica are constantly seeking to improve the public health and social measures in responding to the current COVID-19 situation. So, at this juncture, having conducted a situation analysis on the current COVID situation in Dominica, and following consultation for strategic guidance, as we always do, with the Pan American Health Organization, as recent as yesterday, Thursday, August 12, 2021, I'm pleased to announce that the Ministry of Health has issued a revised isolation and quarantine protocol, which takes effect today, August 13th, 2021. In the new isolation and quarantine protocol, which takes effect today, as I said, August 13th, 2021, we define a COVID case as follows. So for us now, moving forward, a COVID case is defined as any patient, whether symptomatic or asymptomatic, with a positive rapid antigen test or PCR test for SARS-CoV-2, better known as COVID-19. What are we going to do for our symptomatic COVID positive cases, persons who are positive for COVID-19, but they are symptomatic? All symptomatic COVID cases, regardless of vaccination status, that is whether you're vaccinated or unvaccinated, must be admitted to a government-approved isolation facility. At the approved government isolation facility, a PCR test will be done for you on day 5. If the PCR test that is done for you on day 5 is positive, the patient will complete 14 days of isolation and will be medically discharged following at least 3 days without symptoms. If the PCR test done on day 9 is negative, the patient will be medically discharged. How are we going to move forward? How are we move forward with asymptomatic COVID positive cases? You are positive, but you are asymptomatic. If you're asymptomatic and you're positive case, but you are vaccinated, this is how we're going to move forward, or we have moved forward. And we are defining vaccinated patient as follows. The patient has shown evidence that they have completed both doses of the approved COVID 2-dose vaccine regimen or have received a single dose of Johnson & Johnson for COVID-19 vaccine. The vaccine which you have received has been approved by the Ministry of Health and the World Health Organization, and you must receive the second dose or single dose of Johnson & Johnson. You must have received those doses, that dose, at least 2 weeks prior to the date of the antigen or PCR test. What is the procedure when you're going to do the test? Upon visit to the healthcare provider for testing, the individual is required to present his or her vaccination certificate to the medical officer. You must walk with your vaccination certificate. Don't show up and tell the doctor or the nurse, I'm vaccinated. That is not going to be accepted. So walk with your vaccination certificate. The healthcare provider shall be satisfied that the individual has received the required doses of the vaccine more than 2 weeks prior to the date of the antigen test. So it has to be more than 2 weeks prior to you're taking the antigen test or the PCR test. The individual shall be examined and an antigen test will be done by the healthcare provider. Now, if the test result is positive, if your antigen test result is positive, the healthcare provider shall place a wristband on the individual and issue a certificate to the individual indicating the positive test result with recommendation for home isolation. The wristband will be removed by a healthcare provider on the 11th day, and the patient will be medically cleared. So in other words, all asymptomatic vaccinated COVID positive cases will be isolated at home for 10 days with a wristband. And on the 11th day, an authorized, and I repeat, an authorized healthcare provider will remove the wristband on your hand. So I repeat, in moving forward as of today, all asymptomatic, fully vaccinated COVID-19 positive cases will be isolated at home for 10 days with a wristband. And on the 11th day, an authorized healthcare provider will remove the wristband on your hand. What are we going to do, or what are we doing for with unvaccinated patients? All asymptomatic, so you have no symptoms, unvaccinated COVID positive, but you're COVID positive. So all asymptomatic, unvaccinated, but your COVID positive cases will be quarantined at a government-approved isolation facility. At the facility, the following procedure is obtained. On day 5, so 5 days after you had your first antigen test, which is positive, an antigen test will be repeated for you by the healthcare provider at the government isolation facility. If the antigen test done on day 5 is negative, so when you go to the isolation facility, and if the antigen test is positive, the patient will complete 10 days of isolation and will be medically discharged if he or she remains asymptomatic. Now, if you do the antigen test on day 5 when you are at the government facility, if it is negative and the patient remains asymptomatic, the patient will be sent home with a wristband for an additional 5 days of home isolation, which means you'll complete a total of 10 days of isolation. The wristband which you have on your hand will be removed, or can only be removed, by an authorized healthcare professional or healthcare provider on the 11th day, and the patient will be medically cleared, so you are now free. What are the protocols we have in place for home isolation? For home isolation, patients will be required to have supplements and or medication that is prescribed by the medical officer. You're required to have masks when you're doing home isolation, hand sanitizers, a thermometer to take daily readings of your temperature and report your temperature by telephone to your district health team. The contact information of the district health team for which you have to report your temperature will be provided to you when you're leaving the government isolation facility. You'll also be provided with a list of guidelines for home isolation. That will be provided to you. Now, patients doing home isolation must not leave their homes, must not allow people to visit them at home, must not remove the wristband placed on their hands by the health officials, must isolate themselves from others who live at their homes, and you must wear your mask at home. If you need supplies, have someone drop it off at your door. It is an offense to leave your home if you are placed on home isolation by a healthcare provider. And according to the Environmental Health Services Act, Chapter 4201, if you break home quarantine, home isolation, you can be fined up to $10,000. So if the doctor or the healthcare provider tell you have to stay at home for 5 days or for 10 days, and anyone in the community calls the police or the healthcare provider calls the police and say, so and so out of the home, the police will fine you and you can be charged up to $10,000 according to the Environmental Health Services Act. Now, before I end, I really want to encourage everyone to get vaccinated. As you heard from Dr. Esprit, the vaccination drive continues. We have in Dominica the Sinopharm and AstraZeneca vaccines in Dominica, and they have been approved by the World Health Organization. So get vaccinated. These vaccines are safe. But lastly, before I leave the podium, I want to say something about the rapid antigen tests. You have heard about it. The rapid antigen test we're doing in Dominica is specific for COVID, and it is not a vaccine. It is not a vaccine. When you go and do the rapid antigen test, it's not a vaccine you're getting. So if you do antigen test and it comes out negative, as you heard before, don't think, oh, I'm safe, so I don't have to continue to observe the public health protocols. You have to continue to protect yourself and protect others. For now, in Dominica, everybody has to comply with the health protocols. Whether you're vaccinated or unvaccinated, you have to comply with the health protocols. You have to wash your hands often with soap and water and use 70% alcohol hand sanitizer. Wear a mask at all times when you're out in the public or in close contact with others. Avoid touching your eyes, nose, or mouth. You heard those things already, but we must emphasize them. Cover your nose and mouth with your bent elbow, or use a tissue when you sneeze or you're coughing. And don't use it again. Never use a tissue twice to cough in it. Dispose of it safely. If you have a fever, a cough, and difficulty breathing, please call the hotline so you can get medical attention as soon as possible. We are going through a rough period now with the surge in cases in Dominica, but I am optimistic that collectively we can bring the COVID-19 situation under control in Dominica and minimize the negative impact in Dominica. I must really thank every person, and I will not call names, every single person, all our frontline workers and all those working behind the scenes. There are lots of persons working behind the scene, tirelessly behind the scene in the war against COVID-19. So at this point, I want to thank you for your attention, and I wish everyone a blessed weekend. Thank you.
Thank you very much to the Chief Medical Officer, Dr. David Johnson, for re-emphasis. If you have tested positive for COVID-19 and symptomatic, you will be admitted to isolation. There's no question about that. If you're asymptomatic and vaccinated, you'll be examined. If you're positive on the antigen test, a wristband will be given and you will be sent home to isolate. If you're unvaccinated, you will be taken to the government quarantine facility. Ladies and gentlemen, there is no question about it. Some of you try to negotiate. It's not a negotiation. This is the protocol. You will be taken. As we approach the weekend, there are a few things we'd like to highlight. I'd like to remind all of you that in accordance with SRO 22 of 2021, Supermarkets will be allowed to be opened on Saturday, only on Saturday, from 6 a.m. to 1 p.m. Our petrol stations will, however, be open both Saturday and Sunday, and that's from 6 a.m. to 4 p.m. That's petrol stations Saturday and Sunday, 6 a.m. to 4 p.m. Further to that, there has been an amendment to the SRO to allow construction activities and manufacturing this weekend. However, construction and manufacturing companies will be required to follow all the health and safety protocols listed in SRO 22/2021. Construction and manufacturing is allowed from 6 a.m. to 4 p.m. And let me also remind you that, as you have heard over and over again, the health and safety protocols, they work. Wear your mask, wash and sanitize your hands, maintain physical distance, practice respiratory etiquette. I'd like to remind you also that if you experience symptoms, you should not visit the hospital or the health centers. However, call the hotline for further instructions. Let me thank our presenters this evening. I'd also like to thank our media partners, as always. And I'd also like to thank all those who have made this battle a little bit easier. All those who work tirelessly, work so hard, they're so dedicated to this fight. And to you, the general public, for your continued cooperation. Thank you all, and have a good evening.